Good morning. In this episode of the show, I'm going to be talking about screenings, doctors, and the disconnect between doctors and their patients and what their patients want based on what doctors want them to think they need. Now, it's going to be mostly women stuff, but you guys out there, my gentlemen Sharpie droppers, which is what I've decided to call my followers, Sharpie droppers. I think it's cool. It's different. And I like it. So that's what you all are now. You're Sharpie droppers. You men out there, do not turn this show off. And I'm going to tell you why. I'm sorry. It's really cold here. You men all love someone who is a woman. Your mothers, your sisters, your nieces, your daughters, your aunts. So there are women in your life who, by you watching this show, may learn something. Now, a disclaimer. I am talking to you today about my own personal experiences, and I'm also going to ask all of you some questions that you can choose to answer or not. It's up to you. But here's something that I have found, that there is a huge disconnect between the OBGYN and the patient. Now, remember what an OBGYN, how they make their money. They usually make their money off of pregnant women because women go to the OBGYN for, well, pregnancy visits, and the OBGYNs deliver the babies, and that's how they usually made their money. But something started happening many, many decades ago, actually, where responsible and educated women decided to either not have any children at all or have fewer children. These are the smart, responsible, educated women who understand that children are expensive and they take a lot of time. And a lot of women decided they wanted a career or a fun lifestyle, and they didn't include children in that. So which is the other way that OBGYNs make their money? You got it. Annual preventive cancer screenings for women. Now, many guidelines say that when a girl turns 16 or when a girl gets her first menstrual cycle, she should go to the OBGYN and have a pap smear. That was the way it used to be. I strongly disagree with that. Here's why. We know now that 90% of cervical cancer is caused by a sexually transmitted disease called human papillomavirus, HPV, which there is now, because of our technology, we're going to get into that, there's a test for that. So my view is, personally, that if a 16-year-old, and my 16-year-old viewers out there, you better not be sexually active. I'm hoping you're not. But if you are not having sex, there is no reason for you to get a pap smear. There is no reason for any woman to get a pap smear if she's not sexually active. Okay? This is my personal belief. If I were a nun and celibate and had never had sex in my life, I should not need a pap smear. Okay? Because the human papillomavirus is sexually transmitted. So if I don't have sex, I'm not going to get it, which means the likelihood of me getting cervical cancer would be pretty close to zero. Okay? Now, again, my beliefs. So any of you out there who were virgins and diagnosed with cervical cancer, I'm asking you to share your story with me, because it's very rare, very, very rare, that someone that has never had sex gets cervical cancer. So that's my point of view. Here's the other problem, and these are those guidelines that we've been talking about all week. Most of the medical association guidelines that are supposed to be adhered to by doctors by OBGYNs, well, in my case personally, have not been adhered to. Now, maybe I was coming up in a time when we didn't have all these HPV tests and these thin prep pap smears. But the guidelines say that no woman over the age of 21, no woman should be getting annual pap smears. So I have another question for my viewers. My young ladies, if you're using birth control, and the guidelines don't say anything about birth control, by the way. If you get birth control, is your OBGYN or Planned Parenthood facility, wherever you get your birth control from, forcing you to get an annual pap smear, or they will refuse to refill your birth control prescription? It happened to me. I've written about it. I've talked about it. I was a puppet on their string. You do this or you don't get your birth control. And they screwed me. They screwed me huge. And for my gentlemen Sharpie droppers out there, talk to my husband someday about what it was like for the year that Planned Parenthood tried to convince me that I had cervical cancer and that I needed this and I needed that. I needed a biopsy. I needed cryosurgery. And all that happened was their lab made a boo-boo. By the way, and this is where I'm getting into this new advanced screening. The year that I had my first and only abnormal pap smear was the first year I got a thin prep pap smear. And let me tell you, they say, oh, the thin prep, it's awesome. It's going to catch cancer so early. Yeah, but it catches a lot of other things too that aren't deadly, that are not even an illness. Let me give you ladies some advice. And the men who love them, tell your ladies, if your ladies don't watch my show, but you do. Here's what you don't do the week before you're getting your pap smear. Do not have sex. Do not have sex. Do not use any vaginal wipes. No lubricants. Don't take baths. Don't soak your vagina in water, soapy water, in your bathtub the week before your pap smear. Trust me, it has worked for me. Because see, when I had my bad pap smear, I was kind of cocky. I had never had an abnormal pap smear. So I just went about my normal life before my pap smear was scheduled. I love taking a bath. I love having sex. So I did all that. And lo and behold, abnormal pap smear. I don't know if there is a correlation between that, but when I changed my routine before my pap smears, I never had another abnormal pap smear. And by the way, because they now have an HPV test, that sexually active women are, especially if you're not married, you're not having sex with the same partner for years and years and years, you should have an HPV test every 3 years. I agree with that. Pap smear, I'm not so sure about. Because again, they are so sensitive that they will pick up any little abnormal cell. And I'm going to say something a little snarky right now, but let me just tell you something. If you wipe a little sloppy and a piece of toilet paper, or when you're on your period, you take out a tampon, if a little piece of that is left up there, that thin prep pap smear is going to take it as an abnormal cell. And you're going to have an abnormal pap smear. Now, I've already explained this. I've talked about it many times. In case you're new to my show, again, I was treated differently by Planned Parenthood. And I have no problem saying their name. I support Planned Parenthood for poor women who can't afford birth control, because I think birth control is important. But for women that were my age at 41 years old, using them as your only healthcare provider, I don't recommend that. And this is why. Because they treated me at age 41, being married for many years, being with my husband for way over 10 years, and never having an abnormal pap smear. They treated me like a little sexually promiscuous girl that they see on a regular basis. And I didn't appreciate that. Because I had a lot of friends who had had abnormal pap smears in the past. And the rule is you wait 4 to 6 months, you have another pap smear to rule out lab error. And it doesn't harm you by doing that. Instead, Planned Parenthood said, you have HPV, your husband probably gave it to you, but don't get mad at him, he doesn't know he has it. Yeah. Talk to my husband about that conversation. And then they immediately scheduled me for a biopsy, a colposcopy. Now, I was so in shock that I just agreed to it. Then I came to find out the colposcopy was tissue insufficient for evaluation, but the doctor at Planned Parenthood, Dr. Grant, not Grant, they're from England, Grant, said I needed cryosurgery. And that's when I started shopping around. I went on the internet. I went on WebMD. That's how I met my friend Joe Bedden, who is a good friend of mine today from Georgia. I met a lot of great people, and I also got 2 second opinions and 1 phone call second opinion. And the doctor I called, believe it or not, is the doctor who did the hysterectomy on my mother, Jackie Evans, and she was awesome. She called me right back. I wasn't her patient, but when I said I was Christina Winterstrom's daughter and I needed her advice, she called me right back. Because she's a good doctor. And all the opinions I got went contrary to what Planned Parenthood said. I was told 6 months, have another pap smear at another facility, not the same lab that made the mistake in the first place, because they wanted to stand by. Planned Parenthood stood by their lab. No way was it a mistake, but it was, and I proved it. The problem was, back then, there was no Affordable Care Act for women, and even if there had been, again, as I told you yesterday, it doesn't cover treating an ill visit. And basically, every pap smear I had after the bad one that same year was an ill visit. So I had to pay out of pocket. I paid about $1,500 out of pocket to prove that the lab made a mistake. And I proved it. It was really fun trying to get a new insurance policy, health insurance policy that year, because they had to make all kind of phone calls, and luckily I had paperwork. But they were trying to say I had cervical cancer, and I didn't. And I didn't even have HPV. And guess why I know I didn't have HPV? Because for some reason, Planned Parenthood said I had HPV, but had never done an HPV test on me. So they made an assumption. And this is the problem. This is where the disconnect between doctors and patients are. Okay? Maybe it was because it was Planned Parenthood. Because I just walked in there 4 times a year for a Depo-Provera shot for birth control, and once a year, usually seeing a different physician's assistant every year. That I didn't have a relationship. But they didn't know me. So they made assumptions about me. They even insinuated that possibly my husband cheated on me, and that's how I got HPV. But I don't have HPV, and neither apparently does my husband, because we've been together now 21 years in January. And as you can see, this was back in 2006. It is now almost 2018. I'm fine. And 3 years ago, I had a pap smear and an HPV test, and both were absolutely normal, as they all were. But that one mistake cost me a year of my life. This is why I believe that women, especially women, are over-tested. You go every year for a pap smear, and the more they poke and prod, the more chance there is that they're going to find something. And then they're going to rush to say, well, now you need this, and now you need that, when there's actually nothing wrong with you. It was just a lab mistake. The tests today, while yes, it is great that they're catching real cancer, real illness early, they're also false positive, diagnosing people with diseases they don't have. And once you get a positive, you have to prove, you have to pay, you have to do all the other testing to prove it was a mistake. And sometimes, luckily, with my false positive mammogram, it took 7 days. It was 7 days of hell. Believe me, my husband took off work. He had to deal with that too. So again, you gentlemen, Sharpie droppers out there, you really should listen to this show. Because when your wife or your mother or your sister or your daughter gets that bad test result, they lose their minds. I lost my mind. With the mammogram, it was 7 days. With the pap smear, it was a year. A year of my life where every day I woke up with a pit in my stomach, unable to eat, hating my husband, thinking he gave me cervical cancer because Planned Parenthood said he did. It was horrible. Now, of course, after getting the first diagnosis, the first good pap smear, good HPV test, I felt better. But again, you need 3. You need the trifecta of good pap smears and good HPV tests to completely prove that that one lab fucked up. And that took a year. And it was a very stressful year for me and my husband and for any of my friends, because I would just start crying for no reason. Who's going to take care of my dog when I die of cervical cancer? And they kept trying to tell me, you don't have cervical cancer. And I'm like, but they said, because I trusted them. This is the point. When you go to a doctor, you trust them to know more than you do. And what ended up happening with me at the end of that year with the pap smear debacle is I knew more than my doctors did. For example, I told my doctor that there was a blood test for menopause. No, there's not. Yes, there is. And till I stopped doing business with him, he insisted there was no blood test for menopause. But then I found a doctor who said, yeah, there's a blood test for menopause. I'm like, let's do it. Let's do it. This is why menopause was so important to me. And this is something else for you ladies out there. Because I was on birth control, again, puppet on a string. If you don't let us do a pap smear every year, we're not going to give you your birth control. And I'll tell you how bad it got. Because of scheduling issues, I had my last birth control shot, okay? I'm sorry, I was on the pill at the time. I had my last birth control pill, but I wasn't due for my pap smear till the following month. Do you know that that OBGYN only gave me 3 or 4 pills, enough to get me to my pap smear appointment. He would not give me the year prescription until I let him stick his fingers up my vagina and do a pap smear. Now, shouldn't that be my choice, ladies? Ladies and men who love ladies. Shouldn't it be my choice, whether I'm on birth control or not, if I want that annual pap smear? And now the guidelines actually say that having an annual pap smear is more harmful than helpful. And it is It's a nasty circle because, of course, OBGYNs make their money doing pap smears. But health insurance companies now have to pay for the pap smears with no deductible, no copay, so it comes out of their pocket. They don't want to do that. So the doctors say every year, or you don't get your birth control. The insurance companies say, no, every 3 years. That's all we're paying for. And in this situation, I believe the insurance companies are right. I don't believe that women need a pap smear every year, unless, of course, they have previous experience with cancer or something like that. And the other issue is there are other tests that the better they get, the more women get scared for no reason. One is the ovarian cancer. There's a blood test or a test they can do. CA125. And here's where they say, okay, you should have it if your mother had ovarian cancer. But the problem with that test is the false positives. And now for my gentlemen Sharpie droppers, the prostate exam has the same issue. That a lot of men don't like going for their prostate exam because it is the finger up the ass and not fun. And don't even start because even my gay friends do not like getting a prostate exam. It's not the same damn thing. I had to throw a little humor in there. But there's a blood test for prostate exam. They put that out there for the men who don't like the finger up the ass. Problem with the prostate blood test is, again, a lot of false positives, which leads to further testing that is unnecessary. This is why the cost of healthcare in America has skyrocketed, and why insurance companies, you see this is a circle, the insurance companies are fighting back. Because remember what we've been saying all week, insurance companies only make money when you don't use them. And while Obamacare had the right intention, that nobody should not be able to afford to get a preventive screening if they want one, insurance companies are now dealing with, well, we've got a lot of these people now that never got them before getting the preventive screenings, and they're getting positive, there's something wrong with them, they're having biopsies and further testing, only to find out that, oops, our bad, lab made a mistake. You're fine. But the insurance company has to pay for it. The thing is, when there's nothing wrong with you, you don't get your money back that you spent. I did manage to get a portion of my colposcopy, my biopsy for my cervix. I got some of that back from Planned Parenthood because I threatened to sue them. And I did have a lawsuit because of the way I was spoken to by their employees. And the fact that the record showed that they really found no evidence of anything being wrong with me and still wanted me to go through surgery. And that was a problem. And the show is going along. So this is going to actually be a two-part because I do still want to talk about hysterectomies. Very important. Voluntary surgeries, which I think could save money in the long run if women were allowed to do what they want to do with our own bodies. So that's going to be the next show. Not sure if it's going to air tomorrow or next Tuesday. I will let you know. We're getting down to the wire because while I intended to take this whole month off, it didn't turn out that way. There is so much that I have to talk to you about. Our new official season is going to begin on November 7th. And that is the start of the new season. I am going to hopefully have a new set. So even though I will be in Lancaster, the set behind me will be different. We're going to try that out and see how it works. We're going to have a lot of new topics, and we are going to try to more include all of you. And that is why, as I end this show today, what I've talked about this week, I would like to hear your stories. If you don't want to share them publicly, I totally understand. You don't have to name a doctor or an insurance company. I want to hear your stories, and I want to hear both the positive and the negative. If you have had a good experience with a doctor or an insurance company, I want to know about it. But I also want to know if any of you have experienced the things and the many things. It seems strange that I do this show because I have so much personal experience with this crap that is now on the news. The false positives, the over-screening of American women, the blackmail of American women. We're not going to give you your birth control. If you don't get a pap smear, you're going to have to get an abortion if you don't want kids because you're going to get pregnant. Because we're not going to help you to not be pregnant. How awful that I have to submit to something I don't agree with, I don't trust, and I don't want. And you know I'm pro-choice. You know that. But I've never personally wanted to have an abortion. But if I had had to have an abortion, I wouldn't be ashamed of it. But I was hoping that by using birth control, by being responsible, I would never have to make that horrible, very hard choice. Very legal choice. And here at Political Paula, we don't judge any woman who had to make that very hard choice. But how many more women who maybe don't want to get poked and prodded every year and have strangers' fingers shoved up their vagina would be on birth control if the doctors weren't blackmailing them? And you know what? It's been a long time. I've been off birth control now since 2014. And I have not had to get preventive testing for anything unless I choose to for all that time. And it's been really great. It's been very freeing for me. I feel very free. I feel like a true American citizen right now. Like I'm in control of my body and not a doctor or a pharmaceutical company or an insurance company. It's awesome to be me right now. But I worry for all of my sisters and those who love my sisters out there who are coming up. And are you going to be blackmailed like I was? Maybe it's changed since the guidelines have changed and the testing has changed. Now we have the HPV test. I'd like to know, and I'd like to hear from you. So again, I like to keep this show at 30 minutes because I know you guys are busy, and I thank you for the privilege of spending 30 minutes a day with you. So for now, love shows and grows. Remember that. And remember that you are your own advocate. It's your body. You know it better than your doctor, than your priest, than your health insurance company. So you decide, you make the choices, and then you accept the responsibility of living with those choices. Political Paula is out.